Hello everyone. My today's topic is types of adverse event. Firstly, what is adverse event? Adverse event is the unwanted medical occurrence in the patient that may present during the treatment with pharmaceutical product, but the adverse event is may or may not be causally related to the drug. Uh, and types of adverse event is follows. Type A, Type B, Type C, Type D, Type E, Type F, Type G, Type H, and Type U are the classified. uh, Firstly, what is Type A? Type A is the augmented adverse event, where the reaction which can be predicted from the known pharmacology of the drug and it is the dose dependent can be availed by the dose reduction. For example, anticoagulants, bleeding, beta blockers, bradycardia, nitrates, headache, prazosin, postural hypotension. Second is type B adverse event is the bizarre can predicted from the pharmacology of the drug. It is not dose dependent, and it is the host dependent factor important in the predisposition. For example, penicillin causes anaphylaxis, anticonvulsant causes hypersensitivity, and type C adverse event include biological characteristics can be predicted from the chemical structure of the drug metabolite. For example, paracetamol causes hepatotoxicity. Fourth is the type D adverse event. Type D adverse event include occurs after many years of the treatment. Can be due to accumulation. For example, chemotherapy causes secondary tumors. Phenytoin during the pregnancy causes teratogenic effects. Teratogenic effects. Antipsychotics causes tardive dyskinesia. Analgesics causes nephropathy. And type A adverse event include occurs on withdrawal of especially when drug is the stopped abruptly. For an example, phenytoin withdrawal causes seizures, steroid withdrawal causes adrenocortical insufficiency. Classification of the adverse drug reaction is depending on the severity. Minor ADRs, no therapy, antidote, or prolongation of hospitalization is required. Moderate ADR require change in the drug therapy, specific treatment, or prolongs hospital stay by at least 1 day. Uh, and severe ADR, potentially life-threatening, causes permanent damage or requires intensive medical treatment. uh, Lethal, directly or indirectly contribute to the death of the patient. And side effect, unwanted but often unavoidable pharmacodynamic effects that occurs at therapeutic doses predicted from the pharmacological profile of a drug, known to occur in a given percentage of drug recipients. For an example, side effects based on the therapeutic effect. Atropine, pre-anesthetic, causes dryness of the mouth. Acetozolamide, diuretic bicarbonate excretion, causes an acidosis. Side effect based on the different reaction. Promethazine and estrogen. Promethazine causes the sedation and estrogen causes the nausea. Depending on the context, coding antitussive, constipation, and used in travelers' diarrhea. Drug discovery. Occasionally, adverse effects may be exploited to develop an entirely new indication of a drug. So that's all about the types of adverse event. Thank you.